Good afternoon and welcome to the Multicultural Media Online Conference. We're hosted by the Multicultural Health Communication Service, the Ministry of Health, with the support of Multicultural New South Wales. Thank you for joining us this afternoon. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service. And today we're joined by two very special guests. We have Dr. Vicky Sheppeard, Director of Public Health Unit of Southeastern Sydney Local Health District. Dr. Sheppeard, thank you for
Thank you,
joining us.
Jess. You're welcome.
And we have back again with us Dr. Anju Aggarwal. She is a GP and also a member of the Australian Medical Association Council and also the Royal Australian College of General Practice Faculty Council. Dr. Anju, thank you so much for joining us again.
Jess.
Today, we are going to be talking about the importance of immunization in time for World Immunization Day. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to our Aboriginal colleagues who are joining us at this session. We also want to extend that respect to refugee communities and multicultural communities who are represented in this session. So let us start. Dr. Sheppeard, we know that World Immunization Week is celebrated the last week of April. It says it aims to highlight collective action needed to promote the use of vaccines to protect people of all ages against disease. And the theme is for all is humanly possible, which is a really important theme, and we'll get you to answer that. But in Australia, what are the immunization programs and why is immunization important?
Well, I think in Australia, we're pretty lucky. We have one of the most comprehensive immunisation programs in the world. It's called the National Immunisation Program, and that's available for all people. And it actually starts in pregnancy. So we're now vaccinating pregnant women with 3 vaccines that are free through this program that are designed mainly to protect their babies once they're born. And then the program runs all through the decades, and in aged care facilities in the community. There's also vaccines on that program for our very oldest Australians. So it's a lifelong program, and being government funded, it's carefully scrutinised so that every vaccine that's on there is highly effective and cost effective and actually saves Australia money, because by protecting individuals and the community with effective vaccines, that actually saves our healthcare costs. So it not only benefits you as an individual, you don't get sick or as sick, it also saves healthcare dollars. And that's the only way that vaccines get onto that program.
Yeah, you say this, it saves cost to you as a patient, it saves cost to the health system, but it also protects your family and friends.
Yeah, absolutely. Some vaccines are more designed to protect you as an individual, but others are very important for something called herd immunity. And I think we'll talk about that a bit later. Um, and the other wonderful thing about our program is that we also have the first cancer-preventing vaccine, which we've been using since 2007, the HPV vaccine. And that's offered, we offer that one in high school, but it's offered free for people up to 20 if they've missed out on doses. And it's now proven to be the first cancer-preventing vaccine in the world. So it's really quite revolutionary what we can do with our vaccine programs now.
Yeah, as they say, it's a game changer for communities, for families, and also it just gets you ahead, I think, from the very start.
Yeah. And I think a lot of us do think about babies and those first months of life when they're so vulnerable to some conditions. So that's life and death for babies. But through the life, it's improving health, reducing your risk of going to hospital, and reducing the incidence of these diseases across Australia.
Well, thank you, Dr. Shepard. Now, Dr. Anju, when do you get vaccinated and who should get vaccinated? I mean, as Dr. Shepard said, it starts in the beginning with pregnant women, but can you tell us how important this is for the community?
As my colleague Dr. Shepard said, Australia got an excellent program for immunization. It goes through all ranges of age groups, starting from the babies, the childhood immunizations, from 0 to 4, and then the high school immunizations, the pregnant women, pregnant moms, and their some vaccines, then when the baby's coming, the rest of the family should do as well, like whooping cough vaccine. And then it goes to the aged, the ones which are 60, over 65, and over 70. So it goes through the whole spectrum. There are immunizations which are people are eligible free for various age groups. And then there are vaccines which are not covered by the national immunization program. So they're still private, but they're still excellent vaccines. So it goes through various age groups, and it protects them, and as we discussed, protects their loved ones and the community. And vaccine is the most cost-effective way to protect the whole community.
And I think people have to understand that, as you said, NIP, as we call it, it is available for free for certain groups and individuals.
Yeah, I mean, we're extremely lucky that there are so many vaccinations. If they were not free, they cost up to $150 or $250, but they are free. So it's really important that public makes a good use of that option, that they can have it and try to have it.
Now, there are some myths, some people, why they don't want to take vaccine, or misinterpretation of vaccines. There might be some myths and doubt about vaccinations. Now, coming to you, Dr. Sheppeard, again, can you tell us how vaccines work? You did say it is state of the art, it's been tested.
Yes, vaccines go through years and years of research and testing and trialing. And for any vaccine to be registered in Australia, the Therapeutic Goods Administration has to review everything about it and be convinced that it is safe and effective. But the way they actually work, and so it's very much training our immune system. So maybe I think of an analogy like soldiers in an army. So if our white cells are soldiers, if they've never seen the enemy before, they don't know if it's harmful or friendly coming towards them.
Yeah.
So for diseases that we might be quite rare, for example, measles, we don't see it very often, we need to train our white cells that as soon as we get that measles virus, they know, oh, that's a bad thing. And the way they train them is through vaccination. So the vaccination introduces a small component of the bacteria or virus. It can't cause the disease, but it's enough to train our immune system to recognize that if we come in contact with it. And then the training also involves developing antibodies and other white cell responses, so that if that measles virus first, your immune system goes, I've seen that before, I know it's bad. And the second thing is they've already got the armaments against it. The antibodies are pre-made. The cells are trained how to attack and contain that bacteria or virus. So that's how the immunization works, by introducing enough of a part of a virus or bacteria to train your immune system to recognize and attack it if it comes into your body.
Well, I understand it really completely. So it is about your body just knowing what's to come.
What's to come and how to fight it, and having the ammunition there ready to fight.
Now, Dr. Anju, you work with a lot of the communities, and it is about trying to explain, and in your work as a GP, trying to explain, look, this is really important. It's free, it's important, you should use it. How are the people in terms of how you convince people to get vaccinated, so that it might help other health workers and communities to be able to tell their community as well?
I start with, say, for example, flu vaccine. So I start with, look, I had my vaccine. I had it last week, actually. And that helps them to think, yes, okay, yes, we should have it. So, and then at the same time, depending on the age group, you tell them how important it is. It will protect them. It will protect their loved ones. let alone protect the whole community. If they have any question or if they have any fears about it, talk to them. Sometimes they're worried, oh, am I going to have a lot of side effect? Am I going to be really sick? So talk to them about the common side effects, which are minimal and they're safe, effective. So talk to them all about the immunizations and how important they are. And sometimes the vaccines are done to protect the family rather than so much the person. Like the whooping cough vaccine, it's the family who needs the vaccine to protect the new baby. So, and how important it is. So talk to them about the pros and cons, and mostly they do get convinced once you talk to them. Yeah.
Thank you, Dr. Anju. Now, Dr. Shepard, we've heard about the term herd immunity. Can you explain what that is?
Yeah, it's a bit of an extension of what Dr. Aggarwal was just saying. So there's some people in the community, whether they're babies too young to be vaccinated, or they might be people with leukemia or kidney transplants whose immune system is quite poor, unable to be vaccinated or unable to mount a good response to vaccine. So herd immunity is the concept of protecting people like babies and people with immune problems by having large numbers in the community protected against those diseases so that those diseases don't get a chance to take off. And so we're really gathering around and warding off that disease as a community so that those who are really vulnerable won't be exposed, will have a lower chance of being exposed. So again, the classic example of this is measles. And we know in the world at the moment, there's tens of thousands of cases due to gaps in vaccination programs in other countries. And in Australia, if we can keep over 95% of people vaccinated against measles, we have studies to show that then measles can't take off. So we can then protect those who can't be vaccinated due to their immune system or because they're too young.
And I think it is important to understand, and we've talked about this before, is if you have any doubts, ask questions with your GP, go online or go into the trusted sources, and which are the New South Wales Health website where there are resources available. To ask the question, are vaccines safe, Dr. Anju?
Absolutely. Most of the vaccines are, so in Australia, they're all highly tested and scrutinized by the TGA, the Therapeutic Goods and the site, and uh, they are safe and effective both. So there may be a minor side effect like a bit of redness, a bit of swelling around the injection site, and sometimes a little bit of temperature, but they are safe. The vaccines are safe. There is a rare side effect, which is anaphylaxis sometimes to some of the ingredients, which is extremely rare. But apart from that, vaccines are safe and very effective. Yeah.
There's also these questions, of course, because for people who, and I've asked this before, if you were vaccinated overseas and as a child, you do get vaccination, but you don't have the records. And now I have the records for COVID, and that's great. But because I was vaccinated with other things and I had the flu vaccine, I think it's just important that one, tell us how important is this to understand and knowing your history of immunization, and what do you do if you don't know the history?
It's great if you can get your vaccination history completed. So again, in Australia, we're so lucky we have this whole of life Australian Immunisation Register. So that goes hand in hand with the National Immunisation Program because it's important to know who's been vaccinated against what, and that helps any doctor or nurse that you might see. They can check if you're protected against whatever disease. So people who started their life in another country would have been vaccinated, and sometimes there might be some written records that they can bring with them to Australia, and that's really helpful. And a doctor or a nurse or a pharmacist can enter those records into the Australian Immunisation Register so that we can know how complete the vaccination is and then offer make up vaccines if there's any gaps in the immunisation history. So sometimes that's not possible depending on where people come from, in which case we'd probably start from scratch and recommend a complete vaccination to people who don't have records, because it's so crucial that all those diseases like tetanus, diphtheria,
Yeah.
measles, polio are protected against, and particularly if a person's going back for visiting friends and family, because they can be exposed to those diseases when they travel. So really important to catch up with vaccines if there's any missing from your records.
Yeah, and we'd like to ask the people online if you have any questions, and there are resources that are being links that are on that could be sent on the chat. But I just wanted to ask people, if you do have any questions, please put them on the chat in the Q&A, and we'll get Dr. Sheppeard and also Dr. Anju to ask these questions. Now, I guess for me, I mean that's really important. Noting that if you don't have that immunization, you do have now, and you can get started. It's not something that's really unique to Australia, which is fantastic. I guess for me, and the question that people have is that when you travel overseas, and some people are off, and but those who have only a week to go, is it still okay to get vaccinated? Because how effective is it?
Yeah.
Because in the last session, it's advised to take it in 6 weeks or ahead of time. But if you're going next week and you just remembered, is that okay?
It's better to have a longer lead time,
Mm.
a month to 2 weeks. 2 weeks is usually enough for a vaccine to become fully effective. But if you don't have that time, it's still worthwhile getting the vaccine, and it will be improving in effectiveness while you're away. So you might not be at peak immunity in a week's time when you leave, but a week later, then it'll be working. So yeah, I think it's still good to get it done at any time, but the sooner the better if you've got a chance to.
Yeah. So, Dr. Anju, what do you advise people going to you as as a patient, and especially what we always recommend is now, if you're traveling overseas, if you're going anywhere, it's important to talk to your GP so that you are informed of what you can get or
Yeah. So, so it all goes under a heading as well, like travel vaccine. So, Australia does cover for a lot of medical conditions, but there are medical conditions which are more in other countries than Australia. Say, for example, typhoid, hepatitis A, we hardly see in Australia. So, if people are going to some places, they do need the cover for that, which travel by food and water, and there are some sicknesses which travel by mosquitoes. So depending on where they are going, we highly recommend them to see their GP at least a month before, at least, so that they can have the vaccinations done in time and they are protected. So most of these vaccinations, they say it takes 1 to 3 weeks to work. So if they have at least 2 weeks before they go, they are well protected. And then they can talk to their GP that which vaccines they need depending on where they're going. There are places they need yellow fever vaccine, and there are other places they might be high risk to animals and they might need rabies prevention. So there are multiple vaccines depending on where they're going. Some people, when they're going to some of the religious places, they need the meningitis vaccine cover for those places. So they talk to their GP preferably a month before, so that they can have all the vaccinations they need, depending on where they're going.
I'd like to do a follow-up question on that.
Yeah.
Why is that needed when you're saying for religious events? Because of proximity of
Because of the proximity and because of the spread, because there's high density population at that time, and it is to protect their country, and when you come back, your own country and people. So that's why it is compulsory for some vaccines to be done when they go to those countries. Yeah.
Now, we talked about, how a person could be immune from vaccination. What if why should I get vaccination when I can get natural immunity? Is that some people might ask that question?
Yeah, well, most of the diseases that we're vaccinating against, yes, you can get natural immunity, but you can also die from those infections. At, already this year, 3 people in the United States have died from measles. Uh, so, and that includes adults, not just children. So the vaccines are safe and effective. Having many of these diseases is very serious. So I don't know why you would want to have that experience of the disease when you can have a vaccine which has mild to no side effects.
Yeah.
Absolutely. I mean, as Dr. Shepard said, the the medicine today is all about prevention, more about prevention than the treatment for any medical condition, starting from the vaccines, from other health conditions. Say, for example, if someone is diabetic, the aim is to prevent the complications. So if someone is not diabetic, if they're obese, the aim is to prevent diabetes. So it's all about preventing the sickness and the complications and the morbidity and the mortality, which is the seriousness of the illness. So when you can have a vaccine and you can prevent the complications, the seriousness, why would you choose to not to be vaccinated and have the sickness, which can leave you with so many complications maybe, or so many after effects. And as Dr. Shepard said, that in US the measles is already creating a big havoc. So yeah.
Yes, it's scary because it is airborne. I mean, measles and some diseases are scary. And I guess my question is, what are the diseases that are still out there that are important for us to get vaccinated for?
Well, I think measles would be a number one. But right now, as Dr. Aggarwal mentioned, it's now time for annual flu vaccines. And it's important through the lifespan. Last year we saw so many children hospitalized with complications of influenza, and it's so sad. And the vaccine is free for all children 6 months up to until they turn 5. Um, so really needless to have children with those complications. Whooping cough has also been quite prevalent in our community, and then definitely something that babies can die and be very sick from. So that's important. But right, tetanus, for example, very fortunately, we don't see much tetanus now, but that's because people are widely vaccinated. But at any stage of life, if you get a dirty wound, if it's not attended to properly and don't have the vaccine, tetanus is something that will land you in intensive care. So all these diseases, we don't see them very often in Australia, and we don't see the extreme end of them, luckily very infrequently. But if we have gaps in our vaccination, then they will start to recur, just as we have observed elsewhere in the world.
And there are questions in terms of, okay, I got my vaccination, I'm not sure, can I get it again? And I guess is it safe?
Yeah. If they're not sure, they can get it again. And again, as Dr. Shepard talked about the people coming from overseas, if they can get their record, it's good. But if they can't, it's better to get them again, to start all over again and get it done. They're very safe. Yeah.
And we had a question before that if you do get vaccinated and if you do get the disease, the measles, then you've been vaccinated, you're safe.
Yeah, it's no vaccine's 100% effective, but what we do find is that people who are vaccinated, and this probably is observed quite often with influenza, they may still get flu, but they don't wind up in hospital with it. They don't die from influenza or whatever disease if you've had the vaccine. So while it might not be perfect prevention, certainly the severe end of the disease can be prevented through vaccination.
Yes, and this World Immunization Week, the theme is is humanly possible. Can you tell us more about what that means and why people should really just consider how important this is?
Well, um, having an effective national immunisation program, as we do in Australia, it relies on doctors, nurses, and all the people to work together and do the best we can. I should say pharmacists as well, because pharmacists now play a big role in immunisation in New South Wales. It's working together as a community to do the best we can and produce better outcomes for our whole community. So it is a collaborative, a human endeavor.
And human effort. Dr. Anju, how important is it for the community leaders out there to be sharing this information to communities as well? As you say, it is the health organizations, the doctors, but the community plays a big role.
Absolutely. See, community leaders, they have a huge role, because what they say can be more effective sometimes, because they are more in contact with the community, with the people, and more and absolutely trusted. So the community leaders play as huge role as all the health professionals in spreading the word, spreading the message to get the vaccinations done in time.
And in your role, Dr. Anju, there's a lot of questions that people have. So it is those community leaders being informed with information, isn't it?
Yeah. I mean, sometimes we do have joint forums in which there are community leaders and health professionals. I've done some of them in which the leaders are there and few health professionals are there, and we talk about it and discuss more about it. So everyone has good exposure of the questions and answers. Yeah.
I'd like to ask, when you mentioned, Dr. Shepard, about the role of pharmacists, because they are within the community. People, it's so accessible, right?
Yeah, I think there's a lot being said that there's a shortage of GPs and can be difficult to get an appointment with a GP. And also can be costs depending on the individual practice. So we think that by having pharmacists also being trained and qualified to administer vaccines, that this provides more options for people, probably not requiring an appointment in most circumstances, can drop in as long as it's one of the pharmacists that is accredited. And there's a number of programs that mean there's no cost to people with Medicare cards to be vaccinated with NIP vaccines at pharmacists, so long as they're eligible for the free vaccines. So I think that's an option that's really just emerged the past few years, and certainly it is a good option, particularly if it's difficult to get a GP appointment or the cost might be a barrier.
Well, I have a question here. That's someone said, I have a silly question. I tend to get sick after receiving the flu, which makes me feel unmotivated to get it. Why does it happen?
The sickness after the immunization, if it is there, will be very mild as compared to the actual influenza sickness. So yesterday I saw three kids and two adults really, with who had influenza. Two of them had influenza B and three had influenza A, and really, really sick, almost like about to faint. So body aches, high temperature, and it's so debilitating to get the sickness. Influenza, it's not just a cough and cold. Influenza is high temperature, body aches. So it's preventable. So even with the immunization, if you get a little bit of side effects, it is much less as compared to the actual sickness.
Yeah. And just back to the question, which wasn't at all silly, it's a great question. The side effects that you get after a vaccination, like influenza, that's showing you that your immune system is responding to the little piece of the influenza virus that's been introduced. So a little bit of body aches, a little bit of fever, maybe up to 5% of people might need to take a day off work. But that's showing that you've got a good immune system. I don't get any reaction to vaccines. I've had my flu vaccine as well, and I just barely feel it. So probably my immune system's not so great, but if you always get a bit of ache and fever, then that shows that your immune system's detected it and is working and ready to protect you.
Well, that's amazing information. That is great. So if I do get a bit of pain, wow, it's working for me. It's there. It is taking effect. And I guess a lot of people think the opposite. Well, and that's great, great
It's a
information.
barrier for people. But as Dr. Anju said, even if it's a day where you need to take some Panadol and rest up, that's nothing compared to having flu. The last time I had flu was about 1996, and I know I was bedridden for a week. It's really makes you crook if you get flu, and at that time there wasn't vaccines freely available for us like there are now. So I did catch flu back in, I think it was 1996.
Because you've been
And I
fully
remember it
vaccinated.
still.
Yeah, because it's been very painful, I guess.
Oh,
Yes.
it was a really nasty week. Yeah.
Well, we've run out of time,
Oh,
and there
gosh.
are so many things to say and a lot of information. And that's the best thing I will now remember. If I get the flu vaccine or any vaccine and I feel that there's an ache, that means that it's affecting my body and it's a good effect. And it is better than getting really sick. Now, any last words, Dr. Sheppeard, for the people online who is listening to this from the multicultural media, what kind of message and just a reminder that you'd like, and also the health workers working with us in community?
I might just mention another set of resources that you might want to put in as a link called Sharing Knowledge About Immunisation. And those have been developed specifically for consumers. And a lot of the questions we have today are in those resources. It's a great website. So maybe you could put the link in on that too, Jess.
Yes, we'll share them. And there are resources in language available. So that's fantastic. Thank you for sharing that. Dr. Anju, any last words?
That the vaccines are safe, they're effective. Do your flu vaccine as soon as you can. And if you have any questions, talk to your GP, talk to your health provider, and get it done. Don't delay. Thank you.
Yes, and thank you for that person who asked the question. She said that person said they like to answer. So thank you very much for staying with us, Dr. Sheppeard, Dr. Anju. Thank you for giving us all that information. And we hope that you enjoyed this session today. Please watch the recording on the New South Wales Multicultural Health Communications Service website. The links will also be shared on the social media platforms, but also we'll send you an email. If you have any questions, send us an email and we'll try to get the answers from Dr. Anju and Dr. Sheppeard. Have a great afternoon, get vaccinated, and stay safe.